Hi campers, I'm Rachel. I'm the livestock instructor here at MSU Tollgate Farm. I'm going to tell you a little bit about how we manage parasites here with our small ruminants. So ruminants refers to any hooved animal with 4 compartments to their stomach. So that means our sheep and goats. And today I've got some of our goats here to show you. Parasites are kind of just a fact of life when you have grazing animals. The life cycle of a parasite is that the larva is ingested, goes through the digestive tract. Sometimes the adults and the larval stages live in the intestinal tract, and then more eggs are passed out through feces onto the pasture, which are then re-ingested as the animals graze. There's lots of different types of worms, but one of the most problematic is called Famacha contortus, or commonly we'll call it the barber pole worm, because it sucks the animal's blood from the intestinal wall and its stomach kind of spirals around its body, so it looks like a red and white striped barber pole. Got one of the dolings who's a little interested in our camera work here. So what we'll do is do a Famacha scoring method is what it's called. So we'll score the anemia level of their mucous membranes right around their eye. So basically we're going to look at her eyelid and see if it's nice and pink or if it's very pale. So that should help us associate whether she's got a really heavy worm load with barber pole worm and maybe she needs some antihelminthic drugs. That's like a dewormer drug that we could give her to help take care of her worm problem. Or maybe she's nice and bright pink and doesn't need anything at all. So this method's great because it's pretty non-invasive and it can be done quickly. Outside and natural light is where you want to do it. So basically I'll restrain my goat here and cover her eyelid, depress her eyeball, push it in, and we'll pull out her lower lid and watch those mucous membranes pop out and see that hers are really nice and bright pink. So even though I'm sure she does have some parasites, she doesn't have a heavy worm load of the barber pole worm, which is that one that sucks blood and makes them very anemic, or has the potential to make them very anemic. We want to check this basically every 2 weeks the entire year, but most definitely during summer when they're out grazing on pastures, just because their likelihood of ingesting parasite eggs from the pasture increases a lot when they're out on grass. She'll help us with our Famacha scoring. So it's just 4 steps. So you cover the eyelid, push the eyeball in, pull the lower lid, and pop out those mucous membranes. So hers are very nice and bright pink. I would score her a 1 or 2. So the Famacha scale goes from 1 to 5. 1 is super bright pink and not anemic at all, and 5 would be very, very ghostly white where they're severely anemic. If you do have a severely anemic doe, or I'm gonna guess that Gracie here is probably gonna be a little bit more anemic, or Ivy, sorry. So yeah, I'd give her a 3. But that's kind of what I would expect for an animal that's at the end of their lactation. So she's making milk, her body's working a little bit harder. She's probably not doing as good of a job fighting off parasites as some of these younger ones that aren't making any milk.